Professor, yeah, okay, Professor Merim, actually, I know your CV is heavy to be digested. Yani, I can't just introduce you in this يعني limited time, but me personally, I learned a lot from you in complementary medicine, especially in hijama, and we are very pleased to have you today. So you can start because we are running out of time, and we have very tight schedule today. Thank you very much, and you can start.
I was born in Sarajevo, very nice town in the valley of River Miljacka, which is surrounded with big mountains. I'm sorry that you haven't been there. Whoever come again because he like it.
Yeah. I think we need to know the experience all over the world. We are in need for that.
Yes. So I'm a consultant neurosurgeon. I was also until my retirement. I work in the clinical center, university center in Sarajevo. I was assistant professor in medical faculty on surgery and emergency medicine. I finished medical faculty in '95. During obligatory army service, I finished high school for reserve officers of Army Medical Corps. It helped me because we had the war here, organizing resistance and I was a participant of war from 1992 to 1996. Demobilized as Bosnian Army Medical Corps officer in the rank of captain. We prepare with voluntary groups and voluntary formation. We were preparing for defense, which was on door of Bosnia. I was doctor in assault battalion. I was held service commander in few brigades, and at the end in the 12th division, which contained 12 brigades in Sarajevo with 22,000 of soldiers. Finished a European School of Group Analyst after war, 4 years, advanced course in clinical nutrition, training in EMD therapist, and 35 years I'm performing Chinese medicine and 20 years hijama. In Winter Olympic Games held in Sarajevo in 1984, it was the best prepared Olympic Games until that time, according to the president of International Olympic Committee. Everyone liked our hospitality. We live in former Yugoslavia. Yugoslavia means South Slovak nations were united in federation. It was socialistic federation after Second World War. It has very, very appreciated foreign policy because our president was co-founder of non-aligned movement, and first Congress of non-aligned countries were held in Belgrade in 1961. Yugoslavia had a strong people army, Yugoslav People's Army, which in the late 80s had 180,000 active personnel, and in the case of war, it could have 1.5 million reserve personnel as active soldiers. We spent 4.5 GDP on our army. Territorial defense forces were under organizational responsibility of 6 Yugoslav republics, but they were underarmed and under command of Yugoslav People Army. In late 80s, Yugoslav Army started to involve in politics because high-ranking officers become mostly Serbs and become instrument of great Serbian politic. That politic is very, very known now everywhere. They said all Serbs in one country, and many other say it also. So Slovenia and Croatia, Western republics, declared independence in the middle of 1991. Yugoslav army tried to keep borders of country, but they had 10 days war with territorial defense in Slovenia and retreat, mainly in Bosnia and Herzegovina and also in part of Croatia, which were Serb populated. So even they declared in the neutrality, they were on Serb side because of the high command there. Before, in 1992, in the beginning, the army put heavy artillery around town. The explanation was that they are doing military exercises. Bosnia declared independence in 1st of March 1992, but Serb were not happy with that and make rebellion, putting barricades in the urban part of town. Bosnian Yugoslav army had barracks around town, and the biggest one in the central part of town, which had 2,000 soldiers. The command of Second Army was in all part of town. So we were surrounded by Serbs, and the army was inside of town. In 16 May, we made our groups, voluntary groups, self-organized, made action to expel army from center part and to take some territory just to release the town. Town was hermetically closed by ring of artillery. That ring was 65 kilometers long. It has 260 tanks around and howitzers, 120 mortars, machine guns, multiple rocket launchers, snipers, and countless pieces of small arms. This is the view on town from the position from hills around. We were in the valley, and it was everything what was moving downtown was seen. This is a picture from position of rebellions inside of urban area and on the hills. So red dots you can see is sniper shooting positions and area from hills and from high buildings inside of town. People were hiding from snipers, running, and the citizens were under permanent sniper and artillery fire. Particularly danger was from mortar grenades or shells when they came and explode in buildings or in the street, because they spread in thousands of shrapnels. So the bloodiest massacre took place in Markale marketplace 2 times, when 68 people were injured. First time were killed, and more than 150 injured. Second time also, it was great disaster. The problem in such condition was chaos which happened. People who survived, they were so frightened, they were scared, they were under shock, and carrying of wounded people was was done in very bad condition. As you see on the right photo, they said, and that was it until they throw me into back of the car. Such kind of evacuation of wounded people made more problems, more damage than wounded itself. Hospitals were overwhelmed so much. Sorry. This is picture from university center. This is my colleague, anesthesiologist, and she was just crying. Surrounded city, completely surrounded, has only one road for passing. This is called Survival Street. Only Sarajevo International Airport was under United Nations control, and we were completely encircled in one ring. On that airport came some aid, but it was not enough for citizens which were inside. For example, in medical aid, we get some some medicines, but many of them had expiry dates, especially for antibiotics. Even they could be used. We get third of medical aid in one package was oral contraceptive pills, which were not that were useless in that condition. We get first bandage from American first bandage, and the date of produce was before United States get in Second World War, 1941. So the longest siege of capital city in modern warfare in recorded history started, and it lasted 1,425 days, almost 4 years. 50,000 tons of explosive with average 329 artillery projectile per day killed, registered death for 11,541 person, citizen of Sarajevo. Among them, there were 1,400 children. Water and electricity supply was cut to town. We live in dark, without water, except few wells in town. The water was not, there was no water in our town. So what was to be done in preparation for the war? We have done it under conspiracy. We search for residential or private buildings with basement for place for healthcare, for distance healthcare, because we had one hospital and we expect the roads to hospital to be under the fire. We were right. We've equipped few houses for operating rooms with operating rooms. We made plan for evacuation routes and collect medical supplies. During the war, it was very important to know evacuation routes, and medical care for injured has to be done by stages of medical care. First care was self-care with first aid bandage. Wounded soldier or citizen should should help himself by first aid bandage, and everyone has to carry one with them. Carriers of wounded were ordered by name. It was known who will carry wounded people. First aid paramedic was in platoon, medical technician in company, doctor, and it means first medical care was in battalion, and triage and medical care was done by medical team in brigade. Our suburbs close to houses were war zone, so whole town was war zone in fact. These red lines were which you can see, which I draw, was a plan for evacuation, for carrying wounded people to first medical aid, then to triage center. In a big when situation can become with big casualties, triage center was very important, because only the urgent cases were transported, because bridge and roads toward hospitals were under fire. So it was very dangerous to make transport, and triage center help hospital not to be overwhelmed. Emergency categories are different. In many countries, we used very simple one. Patients who need immediate medical specialist treatment were sent by emergency transportation. Those who need specialistic treatment, which can be delayed for some time, were transported when condition outside permit, or if the if patient condition was worsened. Light wounds or light disease were not transported. Also, moribund patients were not transported. Infectious disease increase, of course, what is expected in such situation. There is comparison between first 2 years of war, where hepatitis A increased over 90 times in the 2 years, enterocolitis 34 times, and so on. This down, I have my personal data from when I became a commander of healthcare in military healthcare in Sarajevo. We had hantavirus hemorrhagic fever with renal syndrome. We called it mouse disease because it is spread by excretion of rats and mouses. And this is new cases every month recorded. It is interesting that ambient in town completely changed even for animals. People who had dogs and like pets throw them out because they cannot feed them, and it changed completely environment outside because cats almost disappeared in town. So population of mouse and rats increase. So what shall we suggest for medical professionals now, this in all countries which do not have military conflict? I suggest collect medical material and equipment by your own. Look for suitable alternative places or objects for different levels of medical care outside of hospital. Imagine how to work without medical supply, without water, electricity, internet, and telephone, and organize in that way. There are some medical equipment who can be used and who are made not to be used on electricity. For example, aspirator. There is a pump aspirator. You can do it by manually aspiration. And educate people for the first aid. When war starts, make plan for medical care on every stage. Make plan for evacuation or routes of evacuation. Give first aid bandage for everyone. Especially, I suggest attention to be paid about strict records of patients' name and surname, age, way of injuring. It should be put on piece of paper in common language. We can ask some volunteer to help us, because that data are very important in continuous medical care, but also they are very important when things came to court. In court, there are data, and according to that data, people who are doing violence, who violated international law, they are judged and they get sentenced in participating in killing people. So put name of every person who is injured or who died. Triage should be done by the most experienced medical professional. In hospital, the most experienced doctor. For medical professional during war, start planning. Even we have if you have a lot of wounded people, start planning medical rehabilitation, physiotherapy, and psychotherapy. Early physiotherapy rehabilitation of wounded is very important. Think about prosthetics. Psychotherapy of victims and witnesses of horror are very important. PTSD came in acute or delayed form, even 20 years after disaster. EMDR treatments, rapid eye movements. It is eye movement desensitization treatment. They are very useful of psychotraumatized in all stages of their life. Neurosurgical suggestions, I can say something about head injury and injuries of peripheral nerves, just briefly, just something what will be maybe useful. Head injuries are very often, it could be done by projectile, by bullets or shrapnels or shells. And we know that all wounds are war wounds are considered as dirty wounds. So surgical sutures or stitches are not done on dirty wounds. They are left to make closure and to repair per secundum. Only sutures were done on scalp injury and on, as I know, on joints, joint capsule is sutured. Why scalp injury is always made sutures? Because of anatomy of skull and frontal and occipital muscle, which make tension about on galla aponeurotica. So all our arteries who are breaked or torn artery are expanding their size. So the blood is going out very much. Other suggestion when we have skull injury, always to do palpation without finger. In that way, we can find if there is fracture of skull, of bones. I'm speaking about situation when we don't have electricity, when we don't have MRIs or CT, or when we don't have X-ray. And it is very useful to do palpation inside, always do palpation. Head injuries can go with hematomas. So inside of brain, many kind of hematomas. Glasgow coma scale is very, very important to follow up the conscience, the state of conscience of the patient. Intubation is done when Glasgow coma scale goes below 9 points. It is very useful. It is very easy when we made points about eye opening, verbal response, and best motor response. There are different kind of hematomas which can make problems which can happen after injuring. Injury could be by projectiles or by secondary projectiles. Problem with is done when pressure, when enlargement of hematoma push the brain tissue, and especially it is dangerous when the pushing is going downwards. When vital centers in medulla oblongata and pons would become under pressure, they were moving distally on in the region of foramen occipital magnum. So that pressure, when after we came in decompensation phase, it could take life in a few minutes. What is happening? Pressure downwards in distally, pressure of hematoma made pressure on the longest nerve, which is third nervus oculomotorius, which control pupil dilatation. So we have to control every half an hour to control our pupils the same size. And are they reacting on light? In first phase of compression, ipsilateral pupil, it means on the same side of hematoma, constrict a little bit due to irritation of third nerve. nerve. In second stage, ipsilateral pupil dilatate, made dilatation, as we see on a picture above, dilatation, and contralateral pupil, because of constriction due to irritation of nerve, is smaller. In that moment, we have to open skull. With what? We made bar hole, and after making bar hole on bone, we can epidural hematoma goes out, and if we see dark blue color under dura mater, we shall make incision and let a subdural hematoma goes out. I'm speaking this because in many cases we do not have CT. It was one mobile CT scan in a complete hospital, in main hospital, which doesn't work often, and reparation takes days. So we have to orientate. We have to orientate ourselves how to recognize subdural hematoma and how to open scale. We made bar hole by hand because there were no electricity and it should be done. Missile peripheral nerve injuries are very often or directly or indirectly because of bone fragments, directly by missile or fragments of shell, shrapnels. So also many hematoma in the soft tissues could make damage to nerve because of pressure. Epineural response to trauma is fibrous proliferation and production of collagen scar tissue. It is physiological response, but nerve can appear intact macroscopically, even it is constricted and it doesn't have its function. So what is done? Neurolysis is freeing nerve trunk from adhesions and scar tissue. We do in operation external neurolysis to free from scar tissue, from adhesions. Internal neurolysis is done when nerve is intact but non-functional, or when there is incomplete loss distal to the lesion of nerve, but patient have neurogenic pain. Neurolysis reportedly improves the function of nerve and involves in 3 steps. First of all, opening external epineurium. Second, resection of external epineurium. Then resection of internal epineurium to release fascicles, nerve fascicles. If a gap between the stumps of severed nerve or fascicle group is less than 2 centimeters, then it can be bridged by mobilizing nerve from its bed, flexing, and transposing. Resection of entire extent of the pathological tissue should be performed if healthy tissue is around. Under infection, nothing is done.
3 minutes, Dr. Merim. You have more 3 minutes, okay, please. Okay.
I am finishing in 3 minutes. This is a way in which can be done end-to-end nerve repair. If gap is larger than 2 centimeters, then nerve grafts when donor is cutaneous graft. What should be considered here that physical therapy and rehabilitation should begin immediately after wound heals and should continue for months and for years. Especially is good in rehabilitation. We found electrical acupuncture stimulation. Regulatory process goes in 3-phase: axonal regeneration and connection with the organ less than 1 year, return of elementary motor and sensory function 1 to 3 years, and return of complex and compound movements more than 2 years. When to do it? What is what to remember. Injuries of nerves are very often in wartime, type of operation. That is primary nerve repair, 24 hours when it is clean cut with knife, but it is very rare in war. Dirty wounds have early secondary nerve repair in best condition where there is no inflammation, but most often it is late secondary nerve repair after 3 months. After 24 months, there is no recovery of nerve function. So there is no use of operation after 24 months. Bosnian experience, as it was title of my presentation, operation of nerve even after 8 months were worthy by results. They made good results. So do it even if time has gone after 3 months or more. Late secondary repair of nervus peroneus show very good results. Even previous studies were denying it. Thank you very much for your attention.
Thank you so much, Dr. Merim, Professor Merim, for this interesting lecture. I think the importance of your lecture and the next or upcoming lecture or talk from Dr. Mu'min Diraniya, that the medical skills, we never get it by reading or learning at medical school. We get it by being exposed to the real situation and know what to do. And although the people in the same situation now might be experienced this for years and years and might be more expert than many of us in facing emergencies, but when you are under stress of too much killed people or injured people, and you have shortage in supplies and medications and nutritional supplies and everything, you are stressed. By the way, you even have thinking paralysis. You need someone like you, like Dr. Mu'min Diraniya, who were exposed to similar experience, to give them to-do list, to have it quickly without even thinking. So thank you very much, Professor Merim. As usual, your talks are always informative and reflecting a very wide scientific background. Thank you.